Dependent personality disorder represents one of the most challenging and misunderstood mental health conditions, characterized by an overwhelming need to be taken care of and an excessive fear of separation that leads to clingy and submissive behaviors. This pervasive pattern typically begins by early adulthood and manifests across various contexts, fundamentally altering how individuals perceive themselves and interact with the world around them. People with dependent personality disorder experience an intense psychological need for others to assume responsibility for major areas of their lives, creating a cycle of reliance that can be both emotionally exhausting and practically limiting. The core features of dependent personality disorder revolve around an individual's inability to make everyday decisions without excessive advice and reassurance from others. This difficulty extends beyond major life choices to encompass even mundane daily activities, such as what clothes to wear, what to eat for breakfast, or which route to take to work. The constant need for external validation and guidance stems from a deep-seated belief in one's own inadequacy and incompetence. Individuals with this condition often view themselves as helpless and incapable of functioning independently, leading them to seek out others who can provide structure, direction, and decision-making support. The development of dependent personality disorder often traces back to early childhood experiences and family dynamics. Children who grow up in environments where independence is discouraged, where overprotective parenting prevents natural skill development, or where criticism and control dominate family interactions may be at higher risk for developing this condition. Cultural factors also play a significant role, as societies that emphasize interdependence and collective decision-making may inadvertently contribute to the development of dependent traits in susceptible individuals. Additionally, genetic predisposition and temperamental factors, such as natural submissiveness or anxiety proneness, can interact with environmental influences to create the perfect storm for dependent personality disorder emergence. The diagnostic criteria for dependent personality disorder, as outlined in psychiatric manuals, require the presence of at least 5 specific behavioral patterns. These include difficulty making everyday decisions without excessive advice, needing others to assume responsibility for major life areas, difficulty expressing disagreement due to fear of losing support, struggling to initiate projects independently, going to excessive lengths to obtain support from others, feeling uncomfortable when alone, urgently seeking new relationships when close ones end, and experiencing unrealistic fears about being left to care for oneself. These criteria help mental health professionals distinguish between normal dependency needs and the pathological patterns that characterize this personality disorder. Living with dependent personality disorder creates numerous challenges in personal relationships, professional settings, and overall life satisfaction. In romantic relationships, individuals with this condition often become excessively clingy and possessive, fearing abandonment to such an extent that they may tolerate abuse or inappropriate behavior rather than risk being alone. They frequently subordinate their own needs and desires to those of their partners, creating imbalanced relationships that can lead to resentment and eventual relationship breakdown. The constant need for reassurance and validation can overwhelm partners, who may initially appreciate being needed but eventually feel burdened by the responsibility of making decisions for another adult. Professional life presents equally significant challenges for those with dependent personality disorder. In workplace settings, these individuals often struggle with leadership roles, avoid taking initiative, and have difficulty making independent decisions that are crucial for career advancement. They may gravitate toward subordinate positions where they can follow clear instructions and avoid responsibility, potentially limiting their professional growth and financial independence. The fear of making mistakes or facing criticism can lead to perfectionism and procrastination, further hampering workplace effectiveness and job satisfaction. The emotional toll of dependent personality disorder extends beyond interpersonal and professional difficulties. Individuals with this condition frequently experience chronic anxiety, particularly related to separation and abandonment fears. Depression is also common, often stemming from feelings of helplessness, low self-esteem, and the frustration of being unable to function independently. The constant worry about losing important relationships can create a state of perpetual emotional distress, affecting sleep, appetite, and overall physical health. Many people with dependent personality disorder also struggle with identity issues, as their sense of self becomes so intertwined with others that they lose touch with their own preferences, values, and goals. Treatment for dependent personality disorder typically involves long-term psychotherapy, with cognitive behavioral therapy and psychodynamic approaches showing particular promise. The therapeutic process focuses on helping individuals develop self-awareness, build confidence in their decision-making abilities, and gradually increase their tolerance for independence and uncertainty. Therapists work with clients to identify and challenge negative thought patterns about their capabilities while providing a safe space to practice assertiveness and autonomous decision-making. Group therapy can also be beneficial, allowing individuals to interact with others facing similar challenges and practice social skills in a supportive environment. The journey toward recovery from dependent personality disorder requires patience, commitment, and often significant lifestyle changes. Individuals must learn to tolerate the discomfort of making decisions independently and accept that mistakes are a natural part of learning and growth. Building a support network that encourages independence rather than dependence is crucial, as is developing practical life skills that may have been neglected due to over-reliance on others. Family members and friends play important roles in recovery by learning to set appropriate boundaries and resist the urge to make decisions for their loved one, even when it seems easier or more efficient to do so. Prevention and early intervention strategies focus on promoting healthy independence and self-efficacy from childhood through adulthood. Parents and educators can help by encouraging age-appropriate decision-making, praising effort rather than just outcomes, and gradually increasing responsibilities as children mature. Teaching problem-solving skills, emotional regulation techniques, and stress management can provide protective factors against the development of dependent personality patterns. For adults who recognize dependent tendencies in themselves, seeking therapy before patterns become entrenched can prevent the full development of the disorder. Understanding dependent personality disorder requires recognizing it as a complex condition that affects millions of people worldwide, disrupting their ability to live fulfilling, autonomous lives. While the challenges are significant, recovery is possible with appropriate treatment, support, and personal commitment to change. The goal is not complete independence, which would be unrealistic for any human being, but rather the development of healthy interdependence where individuals can maintain meaningful relationships while retaining their sense of self and ability to function autonomously when necessary. This balance represents the foundation of mental health and personal satisfaction for everyone, regardless of their starting point on the dependency spectrum.